Hi, this is Tim Carter, Superintendent of Wilson Central School District, with a message and update for Friday, December 17th, 2021. And this message and update has to do with reopening items. Um, so this past Tuesday, the 14th, we had a board meeting, and part of that presentation was an update to the board in regards to a reopening team meeting, making some changes to our reopening plan. So this video, which is embedded in this letter, really is to explain some what these changes are and give you an opportunity to make a phone call if you need a further explanation. In the letter, you can tell that at the bottom, you can contact me by email at tcarter@wilsoncsd.org, or you can call me at 751-9399 if you have any questions about this video. So let me get started. I'm going to share my screen. Let me see. Okay. All right. This. Okay, this presentation is the presentation that I gave at the meeting of the Board of Education on Tuesday, December 12th. Let me see if I can begin this show. Let's see. There we go. Just going to go back and make sure. Awesome. It is working. So this is the presentation for the December 14th, 2021 presentation to the Board of Education in regards to the Wilson Central School District reopening plan for 2021-2022 school year. The reopening team met. The reopening team is comprised of about approximately 26 members are invited. It includes myself, board members, administrators, teachers in the district, parents in the district, non-instructional staff, our nurses, and community members. The goal of the reopening plan at the beginning of this school year was to ensure the safety and well-being of all Wilson students and employees, promote equity and accessibility to learning for all students while prioritizing the students that are in school, provide instructional delivery system 5 days a week, foster positive communication and relationship and interactions. On December 8th, which was a Wednesday, the reopening team met, and we used the following items as our agenda items. We talked about the notification of the COVID cases in the district. We talked about the close contact process, which leads to the quarantining of students at the elementary school. We talked about the Wilson Central School District and close contact process in general and how we had been going about doing it. We took a look at the elementary loop pickup time, and we took a look at mental health and academic resources for students. Let me go backwards for a second because I noticed I didn't put a slide in there for the notification of the COVID cases. So currently, after every positive case, I would have sent out a letter informing the district residents. I sent an email to the staff members and to the board members about how many cases were identified, the number of cases in the district since the beginning of the school year, where they're located, and all that stuff. So one of the conversations we had is that it's really not necessary to do that because there is a site that keeps track of this stuff, and it's more of a passive and not a reactive in your face. Here's the number of cases that we have. And the whole idea is we wanted to tone down that process. So it was recommended to the Board of Education that we eliminate the process of sending out every positive case to let the district know let their district residents go out. Know what's going on a constant basis. So instead, in this letter, it'll have the COVID report card link, and you can click on it, and it gives directions in the letter on what you need to put into the little search bar. Just put Wilson Central School District in the search bar, hit search, it will come up, and it'll break it down how many students, how many staff, how many non-school personnel identified as positive, and it breaks it up by the elementary and the middle and high school, similar to what I send out. So instead of having the constant in your face, how many cases, this is more of a passive. If you want to know, it's there for you. So that link is certainly in this letter that's going out. So the elementary close contact process, what we've been doing out of abundance of caution, starting last year throughout the year, Wilson Elementary School was the only elementary school that was in person 5 days a week. And part of that, out of abundance of caution, when we had a positive case, that we would close that class. We had a number of classes closed last school year. In fact, at one point we had 1 or 2 grade levels, the entire grade level closed. And then for a short period of time, for 10 days after Christmas break last year, we had the entire building closed and went remote for a period of time. Instead of closed, I mean remote for a period of time. So this year we met over the summer a number of times, talked with the elementary and teachers, administrators, parents. The entire reopening team met, and we had decided to continue that process. It had worked last year, so we decided to continue that process. So enter this year. Now, keep in mind that last year, entering into Christmas break, we had 14 positive cases in the entire district. 14 student cases, and let me try that again. 4 cases of students and 4 adult cases going into Christmas break last year, so a total of 8. This year, we're well over 88 student cases and 17 staff cases. So that process has led to closing classes, has led to numerous classrooms being closed over and over and over. And there's been a number of requests to take a look at that process. So we did. The reopening team took a look at that process and has recommended to the Board of Education to amend our reopening plan to state that when there is a positive case in the classroom, we would do similar to what we're doing at the middle school and high school, is use proximal contact, which is in using a 3 feet diameter or 3 feet radius around a child. If both the child and the person that they're nearest to is masked, use a 3 feet radius, and anyone that is in contact with that child in that 3 feet radius. So if you're sitting down in a chair, it could be the student front, back, right, and left. So if we're using that 3 foot radius mask, unmasked, it's a 6 foot radius, that will eliminate closing the entire class. Unfortunately, one of the unintended consequences of that is those students that are going out on as close contacts and eventually being quarantined are going to be put on asynchronous instruction because we are not using the cameras in the classroom this year. We want to focus in on our students that are present in school. Talk more about that as we move through this presentation. The second change to the entire Wilson Central School District close contact process, from September to now, we've been very proactive. When a parent sends us a message, we send it to the Department of Health, and we begin contact tracing right away, looking for close contacts to send to the Department of Health so they can do their contact tracing and then move towards quarantining students. So even when we get them, those students had already been in class. Those close contacts had already been together for a number of days. So moving forward in that quick pace, what we've been finding is happening is many times we try to determine as a school district what the look back period is for the child being in school. The look back period determines how long a group of kids are quarantined. The problem is there's been at least 2 or 3 occasions where the look back period that we chose is not the same as when the Department of Health called the parent. When the child was symptomatic, when they were tested, it was off by a day, and it's actually required us to then send another message back out telling the parents, oh, we're sorry, the quarantine period actually is another day or 2 days. And unfortunately, that's just caused a lot of confusion. So what we've decided to do, and the recommendation moving forward by the reopening team, is if a parent sends us a a positive case, we send it to the Department of Health, and we are waiting to begin our close contact list until the Department of Health has sent it back, verified it, called the parent, and let us know what the look back period is. And then they can tell us to go ahead and begin the close contact process. Trying to streamline it a little bit, make it a little bit less confusing for parents, so we're not having to go back and say, hey, listen, we're having to add another day. So this way, the Department of Health tells us what the look back period is. We tell them what the close contact period is. Hopefully that streamlining will help it. We're also going to ask the teachers that are actually in the classroom to help us with that 3-foot radius. So depending on the building administrator may go down to the classroom teacher and say, hey, listen, this child has been identified as being positive. Who are the close contacts to this student? That, some of the administrators may send an email saying, here's the positive student. Can you please identify it for me? Here's the guidelines for close contact. Can you identify whether or not they're really considered a close contact? Please remember, if your child is vaccinated or if your child had been positive, they are exempt from quarantining. If the student has been vaccinated, they're exempt from being quarantined. And if they're been positive, they are exempt from quarantining for 90 days from the date at which they're positive. That's directly from the Department of Health. So that's the second point of change in the close contact process. We did talk about the elementary loop. Basically, it was just it was asked of me by a number of elementary parents just to take a look at the elementary loop. Most of the requests had to do with the length of time at which it was taking to dismiss the kids. Most of these requests came earlier in the school year. I watched a number of pieces of footage of videos of the elementary loop and went over there and spent a couple days in the afternoon taking a look at this process. And I can tell you that what I saw was a safe, orderly dismissal where kids were being dismissed, and within 25 minutes, the elementary loop was cleared. Now, some parents were coming in early. I can't help that if you're choosing to come in early. I didn't add that time into, but basically from the time that they began dismissal to the last car leaving was approximately it averaged per day between 20 to 25 minutes. And it was a very safe and orderly dismissal. The recommendation from the reopening team was to make no changes to that. Health and mental health and academic supports. We kind of talked a little bit about this. Wilson has purchased a product called Wilson Cares. It's being created for the Wilson Central School District. We rolled it out to the staff members a couple of weeks ago, maybe a month at this point, for them to be able to use. We're in the process of getting it ready, and we're hoping by mid-January we have it ready for the families. This will be open to families, hoping that any student that is having mental health concerns. This site is more than just for mental health concerns, and I'll do a video on this and kind of walk through this product when it's up and ready. But it's for mental health supports. There's parenting tips and ideas on there. There's financial planning ideas. There's all sorts of legal supports. There's just a bunch of stuff on it that we want to be able to, provide this for the families. Wilson Central School District is also in January our school improvement grant was approved. So we are going to hire a grant funded social worker to assist families and assist students with whatever social work needs they may have. And then for academic supports, we have had a few students that have been out multiple times for quarantine, being positive and things like that. And the building principals know this, the counselors know this, but I want to just make this known that if a child is out multiple times and is falling behind, we do have some academic supports in regards to AIS, which is Academic Assistance Services, but also because if your child has been out due to COVID or due to being quarantined multiple times and has missed chunk of work and needs to make things up, we do have the ability to assign a home hospital tutor for the child to be able to help make that up. It's a certain amount of hours for the high school, middle school, and it's a certain amount of hours a day for the elementary school. And again, If that's something if your child is falling behind because of the quarantines or being positive and needs an assistance, we can't send somebody to the house or work with your child while they're under quarantine. Unfortunately, that's not allowed. But after they've come back and are out of quarantine, we can still provide some assistance with that. Again, call the building principals if you feel that your child falls into that particular category. Other items that I wanted to discuss. Recently, the Department of Health of Niagara County did a press release and talked about this test to return to school. All of the information is on the Niagara County Department of Health website. It is specifically for quarantined individuals, unvaccinated people that are students and staff that are quarantined and that have no symptoms throughout the quarantine. They can test one time on either day 5, 6, or 7 of the quarantine. The test can be an antigen test or a PCR. And if the test is negative, the child and staff member can return on day 8 of their quarantine. 2 caveats to this. One, I know it doesn't eliminate the quarantine. If I could, I would. But it does reduce it by 3 days. And by the way it works, and streamlining our process and waiting for the Department of Health to identify that the child is truly a close contact and what their quarantine date is. By the time we do identify them, many times it's day 4 or 5. So your child could return in a lot less time and not be in quarantine for the entire, 10 days or 8 days. So that's the first caveat to that, is that, by the time we get to identifying those close contacts, plus this return from quarantine early or return to school from quarantine early, hopefully we're going to start reducing the number of days children are going to be out of school, which is one of the goals. The second caveat is, which I didn't know when I went to a Department of Health meeting, is on the Department of Health website. I found this out from a parent who sent it to me. Besides the test, there's an affirmation. The affirmation is attached to this letter. I copied it and attached it to this letter. It's a link. You click on the link that says affirmation, and you can print that, or you can print it from the Department of Health website. And it basically just says that your child was supposed to be quarantined, and your child's been symptom-free. You sign it, your child's name, signature, that should be turned in with the negative test. If your child got tested at one of the mobile test sites, that's one of the school district's test sites, either at Newport, Wilson, one of those test sites that are Niagara Wheatfield, Lockport, Niagara Falls. If you went to that mobile test site, you won't get a negative test result. I get them sent to me. So if you go to a mobile test site, all you need is the affirmation. I get those results sent right to me. I'll make sure the nurse gets them. Okay, so that's the 2 caveats. I get it. It's not reducing beyond 3 days, but at least it's something to be able to offer. Another item, children and staff members with symptoms. Up until now, right around this week, if a child or a staff member became symptomatic, they would have to go get a PCR test in order to return to school or to work. Right, the Niagara County Department of Health is letting us know that they are authorizing all school districts to use either a PCR or an antigen test. The PCR tests are the longer ones that you have to wait for the results. Sometimes it's a day, sometimes it's 2 or 3 days. Sometimes it's, in the beginning of this, it was like 4 or 5 days, and we were holding kids out of school for multiple days because they were sick. And if you have a child that's been sick in the elementary school, been quarantined a couple times for their class, there's a lot of days that could be added up. So our hope is this antigen test, which is that rapid. If you go to one of the local school district testing sites, again, those testing sites are on our district webpage under COVID information testing. If you go on there and you test, you go to that, you can log in a time. If you go get that test, in 15 minutes, that test is done. The next day, I have the results in my email. And if I don't, I can get those results by calling somebody. So our hope is that also is going to help meet our goal of reducing the amount of kids that are being out for long periods of time. This other item, it is not recommended or supported by New York State Department of Health yet. And and it's not currently happening in anywhere in Niagara County. It's called Test to Stay. That's for any student or staff member who is quarantined because they're unvaccinated. And if you're symptom free, according to this Test to Stay option, you can test on a daily basis and stay out of quarantine. So the way it works is if you're quarantined every morning before school, you would have to meet at a location that the school would pick out. It would have to be tested with one of the antigen tests. If it's negative, you can go to school that day. If it's positive, you'd be sent home with your parent. Parent would have to bring the child to school to get that test done. Again, one of the positives to that is it would allow any parent that would want their child to be tested to stay out of quarantine to come to school that day. Again, it requires a parent saying they're okay with it, and there has to be a sign off by the parent that they're allowing the school district to test their children. So again, it's for any student or staff member who are quarantined, are symptom free, they can test daily and stay out of quarantine. Unfortunately, it is not recommended or supported by New York State Department of Health, and it's currently not happening anywhere in Niagara County. In fact, in all of Western New York, which is, well, it's Erie and Niagara County. In all of Erie and Niagara County, there's one school district that is doing it, and that's Grand Island. And they're doing it because they're being considered a pilot program. What we're being told by Niagara County Department of Health, there's just not enough testing supplies being sent to Niagara County for us to be able to do it. So it's not being supported with the number of tests for us to be able to do it and to get our kids back to school in a quicker amount of time. That leads us to another item, which is a resolution. Senator Ed Rath wrote a letter to our governor, Kathy Hochul, and also to the New York State Department of Health. And it was signed by all of the legislature and in New York State that is from this area. So any of the assemblymen, any of the senators from New York State signed this. And the letter was basically asking the governor to tell the Department of Health to support this test to stay option, because the test to stay option will allow our kids to not be quarantined as long as they come to school and be tested. The Wilson Central School District also put forth a resolution basically asking the governor to do the same exact thing. That resolution was passed at this last board meeting. It was signed by all board members and myself, and it's being sent to every school district in Western New York, and it's also being sent to every senator and assemblyman of Niagara County and Niagara County representatives in the Niagara County legislature, and we're also sending it to the Department of Health and Governor Hochul's office. I don't know what the impact it would be, but we want to let everybody know in our community is that Wilson supports the test to stay option. And if Niagara County is allowed to do it and we're able to move forward with it, we would make sure that we put the resources we needed to get our kids back as quick as possible when they're quarantined. And it really kind of upholds that piece is if kids are not sick and they're not testing positive for COVID-19, they should be in school. If you have any questions, please don't hesitate to email me at tcarter@wilsoncsd.org, or you may call me at 751-9399. You can always respond directly back to this video link. The letter is going to be in an email form. You can respond back right to this if you have any questions. Again, this is an update for our reopening. Our hope is that while we've tried to stay open as much as possible, we do understand that there's been some classes at the elementary school that have been over and over being put on quarantine based on the processes we put into place. And this particular reopening adjustment and update is really trying to make some changes to that to make sure that we're not quarantining entire classes, just the students that would be considered in proximal close contact. Again, I thank you for taking this time to watch the video, and I want to extend to each one of the families of Wilson, I wish you all a happy and healthy holiday season. Please stay Wilson strong.